Supplements that actually work for mold. I'm Dr. Martin Hart here live with Microbalance Health Products. Tonight, you guys, we are talking about what to do with the supplements if you're trying to recover from mold illness, mold toxicity, mold allergies. What are we going to do that really helps you with that? Because you can find all sorts of protocols online, right? And what we don't want you doing is taking a pill for every ill. We don't just want you taking a supplement that's good for mold. Tonight, we're going to help you understand how to build a protocol that works for you and to go over some products that are highly effective, that are useful, why they're useful, and how to build them in. Guys, I'm super excited to do that. Super appreciative to Microbalance Health Products and their team for bringing me on board for this. We love and use their products. That's how we've gotten hooked up with them. So we're excited to jump in. One of the things I want to talk about tonight is that how does mold affect you in 3 different ways? Because that is how we're going to build the protocols out, right? So mold can affect you as an allergen. And again, as we go, I want you to be aware, this is not medical advice. This is simply for your informational purposes only, not intended to treat, cure, diagnose medical illness, right? So mold can be an allergen. Mold can be a toxin from the mycotoxins from the mold spores, or it can be a fungal overgrowth. You can get mold colonization in your sinuses, your lungs, your gut, your skin, right? So it can affect you in 3 different ways. So you need to keep that in mind. If you're having mold toxicity, you may not need an antifungal, right? Or to treat mold and overgrowth if you don't have that. So that's a key factor. Now, as we discuss the supplements, a couple of principles. 1, go slow and low. Start low and build up. Sometimes the problem with the supplement, people feel they don't work, or they have a detox reaction or Hertz reaction. The issue is not the supplement a lot of times. It might be the dose, right? Start slow and work your way up. We need to build it up. Another one is make sure you're using high quality supplements, right? Make sure what's in there is what you need and start them in the right order. Okay, there's an order to this, and that's what we're going to talk about tonight. And for your information, guys, if you want, Microbalance Health Products has a great website, sinusitiswellness.com. I do have a blog post I wrote that accompanies this. So you can see it in writing, right? So let's jump in. So we talked about mold can be a toxin, right? Mold can be an allergen. Mold can be an infection or overgrowth or colonization. Fungus and mold produces mycotoxins as a defense mechanism, as a communication mechanism. They produce these microscopic toxins that are meant to ward off defenders. They want other things going after them, so they produce toxins. So when mold is overgrown in your home or even in your body, it produces these mycotoxins to try to defend itself from you and other animals and insects and etc. Right? Those are one of the big things that cause a ton of symptoms for us, especially in chronic inflammatory response syndrome and mold illness, are these mycotoxins. They create the hormone issues, the suppressed immune system. They create brain damage and neural damage, right? So these are the biggies that are doing that. Well, number one, if we're going to deal with mold as a toxin, which is the biggest aspect here that creates problems for most patients who are dealing with mold exposure, mold illness. And guys, hey, don't forget, whether or not you're on Instagram, Facebook, YouTube, throw your questions out. We'll answer them as we go along. We want to make sure this is interactive. We love doing that with y'all, so throw them in there. When you're dealing with mold as a toxin and you're building a supplement protocol for this, number one, you got to make sure your drainage pathways are open, right? So we need to make sure you can actually get the toxins out. We don't want to detox the cells if you can't take the garbage out. So are you pooping? We want to make sure we move the bowels. Okay, so for some folks, probiotics are going to be key there. And this is a double bonus. Probiotics actually bind up mycotoxins as well. So they act as binders as well as support the bowel function, support the gut flora, keep you pooping. Other supplements that work great in there, magnesium citrate, magnesium oxide, keep you moving, or herbs like senna, cascara, aloe vera leaf, right, inner leaf there. All those are great options. Keep the bowels moving, stay hydrated. Number 2, we need to keep the toxins moving out through the lymph, liver, gallbladder, kidneys, and the colon like we just talked about. We got to start this early once you're pooping, right? So we can use some liver gallbladder support. Microbalance makes a great product called Myco Detox Liver Support. But the key here is that the ingredients work together. So the milk thistle seed extract, that really supports the liver, the gallbladder, the kidneys without overwhelming the detox channels. And number 2, it's very organ protective against mycotoxins and mold, meaning it protects your organs, including your brain, from mycotoxins. Also in there is artichoke leaf. We use this a ton. The team was just in asking me for a little more artichoke leaf extract for some patients. Right? This is very good for getting uh, the gallbladder and bile moving, right? We need to get that out. So the toxins leave the liver through the gallbladder, right? And so artichoke helps to make bile to leave the gallbladder and helps it flow. Also great for hormone balance. Turmeric root extract is in there. That is great for the liver. It is great for inflammation, protecting the immune system, also from mold exposure, but also it allows the gallbladder to contract to get the junk out. Has methionine, choline in there, and acetal, all very, very good for the liver, supportive for the liver, getting it flowing. And dandelion root, which also nourishes the liver, kidneys, keeps you flowing in that way. So we want something that hits that liver, gallbladder, kidneys, lymph, and colon, right? So that one does that. Another great supplement is N-acetylcysteine, also known as NAC or NAC. This one, you got to start with the liver support, kidney support, and bowels first, but then you can often add this one in very, very well. It supports our body in making glutathione. And here's an important caveat to that. For some mold toxins like gliotoxin, if you just take glutathione, it might aggravate the gliotoxin. But that doesn't happen with NAC because it can be an antioxidant by itself, and it can help the body upregulate glutathione, helps clear mucus out of the lungs, right? So it supports the kidneys, it supports the liver, great way, supports the brain function, and it calms our nervous system down. So it's a great detox aid early on for mycotoxins. We use this a ton, also great for heavy metals. What if you don't have a gallbladder? Any considerations? This is really important, guys. If you don't have a gallbladder, you really have to support the liver. Okay, because now instead of the gallbladder is like a little bladder, right? It's a little bag that holds the bile and releases it at the right times, right? When you don't have a gallbladder, your liver is going to release little bits of bile all the time. And so we want to do a couple of things. One, we want to train the liver to try to release it at the right point. So we do that by trying to have consistent meal times, right? That way we can train the nervous system and the body and liver to release bile at the right times. Two, with the same pathway for drainage, you can still use like artichoke leaf because it's the liver that makes bile, and like choline because that's what helps to move the bile from the liver. But what we need to do is take those right before meals, right? And that way, that really gets them moving at that point. And then we might add in a little bit of ox bile for digestion to help if you don't have a gallbladder. A lot of my patients have gallbladders, need that. And I wouldn't go super crazy on fat if you're not tolerating well. So that's how we help out with they don't have the gallbladder. The next one is phosphatidylserine. Sorry, I was reading the NAC mast cell question there. Phosphatidylcholine. There's also phosphatidylserine. But phosphatidylcholine is important for a couple of reasons. One, we need it to move the bile out of the liver, into the gallbladder, out of the gallbladder, into the gut. Phosphatidylcholine does that very, very well, gets that draining. It's very helpful. If you have high cholesterol or fatty liver, phosphatidylcholine is a great way to help the body support that pathway. It also nourishes the brain, helps the brain make like things like acetylcholine, helps protect the neurons, right? Helps heal the membranes in there. It's very good for our mitochondria and our cellular membranes, which when our cells have to drain, they need to go through the membrane. So phosphatidylcholine helps nourish that. So really, really like phosphatidylcholine for that, especially if somebody has mold issues and gallbladder issues. Very, very helpful. And then kind of along that list, what we've already mentioned, magnesium malate. So the magnesium part can help nourish the bowels, but also the liver, over 300 processes in the body. But when it's connected to a malate, that malic acid helps to thin out and get the bile flowing from the liver and gallbladder, right? So that's very, very good there. That malic acid really helps that. We talked about artichoke, ginger, dandelion. So those are very helpful. So that's how we get the drainage up and running. And again, we want to make sure we're exercising to move the lymph. We're doing good breathing exercises to keep the lymph moving, to keep the bowels functioning and flowing, sweating and staying hydrated. Lastly, within the toxin side is we want to use binders. Okay. So there's a couple of questions here. So let me talk a little about how long should I bind? A long time, right? We'll have patients bind for a long time until either their urine tests show clear mycotoxins or just maybe on and off. So even for myself, where I'm not exposed to high levels of mold very often anymore, still a couple times a week, I'll take a binder just to help clear out other toxins. But in general, patients will be on and off binders for probably a year or so while they're detoxing. Even when they feel great, we'll keep them on at least a low dose to keep grabbing that stuff up. Because what do the binders do? They function in different ways, but they literally grab up and hold on to those mold toxins and even some mold spores. Okay, and so there's great different blends. Bioactive binder from Microbalance has a blend of toxin binders. That's important because each one binds up different types of mycotoxins and mold spores and other toxins, heavy metals, pesticides, herbicides, all that sort of stuff. So it's a very good blend that does that. What are the different types? We talked about probiotics are a good binder, right, for that. Humic and fulvic acids, activated charcoal, clay, all that sort of stuff is very helpful on that front. Just got to stay hydrated because you got to watch out for constipation. Some binders do have to be taken away from medications, okay, and foods. The other ones that bind up, again, things like microflora balance, because it's a probiotic, does very good to bind up mycotoxins, and immunoglobulins help to bind up mycotoxins as well. So IgG Gut Protect is a great one. Here's a big thing, though, that I really like about probiotics and immunoglobulins as binders is they help to heal the gut wall, which protects us from reabsorbing mold toxins or toxins in our gut. And when we first get exposed, it helps protect us. So that's really big, helps to reduce the reactivity of our body to that. So that's why we really want to keep up with the binders, and we use them as long as we need. I do like to have patients and clients take breaks. If they can tolerate it, I like them to take the binders 5 days on, 2 days off, right? And rotate binders is a good idea, do different types, etc. Somebody on here, we're stepping back for a second. What about sulfur? So some people can't tolerate high sulfur, NAC, glutathione, or high sulfur content. You can go low dose, number one. You can take it with molybdenum, which is a mineral that really also helps detoxification, but helps us process our sulfur. So you can take NAC with molybdenum. That works great for a lot of our clients and patients in there. And it helps with other processes too. And it helps with candida and fungal detox. Molybdenum does. NAC bothers my MCAS. So NAC can also stabilize and help with histamine, which is what this person's talking about, is mast cell activation, which is where part of your immune cells release inflammatory compounds like histamine, tryptase, those sort of things. If NAC bothers it, we need to more so probably look at a couple of factors. Is it doing too much detox for you, and that's what's actually aggravating the mast cells? Do you have a sulfur sensitivity that aggravates the mast cells, right? And so we can back up, which we'll talk about now. It's a good segue. For some folks, when we're building a protocol, we can't start with detox. This is why it's good not just to, is this good for mold? We want to know, is this good for you when you're dealing with mold? That's the key here, and that's what this is all about. So some folks, like Heather here on Facebook, we've got to deal with mold as an allergen first, right? Because it's aggravating those mast cells. Now, mold as an allergen is what most of us think about when we think about mold. If somebody goes, you just got a little mold, we'll just take an antihistamine. That's what the thing about. And sadly enough, that's what most people in the medical community are thinking about, is mold as an allergen. Now, it's still a factor, of course, right? But it's not the major issue like we just talked about the toxins. Because mold, the mycotoxins, they directly increase histamine production in our bodies, create an immune response, aggravate our mast cells. And somebody with mast cell activation syndrome is probably feeling pretty miserable. They're reacting to a lot of things, right? So that can make us with skin flushing, red skin, hives, rashes. This is how mold causes asthma. Guys, let me read this quote from a study to you. And this is a direct quote. Mold is one of the largest risk factors for asthma, increasing asthma risk by 53%. Everyone with asthma should consider mold as a possible cause. Anybody with asthma needs to rule it out, because what they're actually seeing in a lot of the research is that mold is the primary cause in asthma in a lot of individuals. Okay, so asthma, eczema, headaches, irritability, loose stools, dizziness, anxiety, difficulty sleeping, itching, burning, acid reflux, stomach pain, low blood pressure. When mold is an allergen, it can cause all those aspects. So sometimes before we can detox it, we have to stabilize the inflammatory allergy part of mold on there, or we have to do it at the same time, right? So how can we help the body lower histamine? And this is with NAC, right? We can talk about this too, is stabilizing this first. Okay, so we can look at a couple of factors. One, we might need to, and some folks might need to start with these individually, or we might need to open up as singles. So Microbalance makes a combination product called Histamine Relief, full of a lot of things that are mast cell stabilizing and natural antihistamines. Here's an important caveat, because when I say antihistamines, most of you think of what? Like diphenhydramine or brand name Benadryl or loratadine or Claritin, right? Over-the-counter antihistamines. Those are not actually antihistamines. What they do is they block histamine receptors, whereas natural antihistamines work on multiple ways. They stabilize mast cells so you don't release as much histamine. They help your body use the enzymes to break down histamine, and they help block histamine receptors. So it's different, right? So quercetin is a natural bioflavonoid that helps to stabilize mast cells as antihistamine. So you can get a combination product like Microbalance's Histamine Relief or by itself. Stinging nettle is in there, vitamin C, NAC, bromelain. They're all in there to do that triple factor of break it down, block it, neutralize it, right? And so if you're really sensitive, though, you might start with just quercetin or just stinging nettle, again, low and slow, and stabilize that histamine mast cell. For some folks, when it's mold as an allergen, we'll do Citradrops nasal spray, right? This is a great one to start with. If you can't start with like antifungals or something stronger, it's got both like supplement side and homeopathic side. So it's very gentle, great for mold, supporting the body and dealing with mold as an allergen, right? Very, very good. Rutin, luteolin, olive leaf are other good natural antihistamines, right? Feverfew is particularly good if the histamines are causing headaches. And then diamine oxidase is a digestive enzyme that we naturally make, but you can take it as a supplement to support the breakdown of histamine in your foods. That's very helpful on that front. I highly recommend, if you're dealing with MCAS and histamine as a mold as an allergen, limit your moldy foods like peanuts and things like that, but also limit your high histamine foods like avocados, fermented foods, that sort of thing. Okay. In there, I want to go in there. Yeah, somebody said Bioactive Binder is my fave. 100%. It works great. Is there a link between mold and high cholesterol? Yes, there is. Great question. Yes, there is. Why? Inflammation, number one. But number two, our body will use cholesterol. Get this, everybody who's been to a doctor who wants to put you on statins. Mold will raise LDL cholesterol, the bad cholesterol. Why? Because LDL cholesterol will bind to mycotoxins. Our body will naturally make a binder to lower mycotoxins in our bloodstream. It will raise LDL to do that. And then when mold stresses our liver, our body will raise cholesterol and LDL to try to protect it. Cholesterol is a transporter for fats, but it is also a patch. Its job is to patch and lower inflammation. So if you're inflamed from mold, it will raise cholesterol. If you have mycotoxins in your bloodstream, your body will raise cholesterol, right? So it's important. We can't just shut that down. Oh my gosh. Imagine taking a statin while living in a moldy environment. Holy poop, you guys. What are you doing? You're shutting down your body's ability to deal with the mold and mycotoxins, number one, and you're limiting your body's ability to deal with the mitochondria to support healthy energy and function and to have the energy to detox that stuff. No wonder so many people feel bad on that sort of thing. I'm not saying don't take them, follow your doctor's advice and your own health practitioner, but you got to understand what's the root cause. Why do you have high cholesterol? That's why for a lot of folks, right? Second part with the DAO and mold as an allergen is we need to improve digestion, which helps, number one, to reduce allergens in our system and reduce inflammation, causing more allergens and histamine. Digest Assist from Microbalance Health Products is important. If you don't have a gallbladder as well, this is very helpful, by the way, guys, Digest Assist, because it has the enzymes not from a plant source, but directly from animal sourcing, helping you break it down. Why is it important? Where do we grow plant-based digestive enzymes? We grow them on mold most of the time. We grow them on aspergillus. So many people who are mold sensitive or allergic to mold probably can't tolerate plant-based enzymes. Something to think about. And you can buy DAO as an enzyme for that front. Okay. Okay. High mold, cholesterol. So I have all three, Laura says. She says, I have fungal overgrowth creating toxins. I've tested allergic to these molds as well. How much does the allergic component contribute to my fatigue? A ton. Think about when you have hay fever or seasonal allergies. You're exhausted, you're miserable, you're itchy, your blood pressure's low, your adrenals are tanked. So like allergies and histamine will tank your adrenals, right? And so that's what you do. Your adrenals are how you respond to stress and get energy going. So mold as an allergen is a big strain on your energy pathways, right? And so for all the reasons we just said, and then mold is a toxin for sure, causes fatigue and is an overgrowth. So you got to deal with all three, especially when chronic fatigue is a factor in there. You really got to deal with it. And any of these are a stressor on your system. It takes energy for your immune system to have an allergic reaction. It takes energy for your detox pathways to detox mold toxins. So when this burden's on there, your body has to have an energy budget, and it's not going to do it to keep you up and running if it has to keep you alive to deal with these other things. How can I support my 1 and 3-year-old? We have to continue to live in a level 10 moldy home. First of all, I am so sorry you have to continue to live in a level 10 moldy home. What we give our patients is we have some handouts for them if they have to be in there for a little while. But this is where EC3 comes in. EC3 from Microbalance Health Products comes in super handy, right? Because they give you a lot of options to deal with this. Number one, with little kiddos, they can take micro doses of binders. And even if they need to be taken with food, if they're not on medications, you can mix it into applesauce. You can mix it into some yogurt or dairy-free yogurt. You can mix it into a little bit of juice, right? Get them on some binders. You can get them on histamine relief. Kids do histamine support really, really well. You want to support your body in these pathways. And then secondarily, you want to be limiting how it's getting into your system from the environment as best you can. Get some HEPA air filters going, right? Open the windows, but you can use things like the EC3 mold candles. Let me see if I brought one in. I did. Like, our patients love these. We travel with them. Actually, today I had a patient in from Pennsylvania, and they were asking me, which we'll talk about the fogger here in a second. When people come in who are maybe have moldy homes to our house, we get a little reactive without short of fogging with them, fogging every person that walks in. How can we help? Light the candle. Who doesn't love a good candle, right? So EC3 makes a soy-based or a honey-based candle that you can burn that really helps. And when we take these to hotels, game changer when traveling, right? So this helps to limit mycotoxins and mold spores in the air. You can be fogging with the EC3 mold solution. You can be nasal rinsing, which we'll talk about, so you can limit the amount of mold spores and mycotoxins coming into the kids' sinuses. And what we'll do with kiddos, right, if they won't let you, and you would be so surprised with little kids, even like especially 3-year-olds, how much they'll let you do, teach them to spray and sniff. But what we'll do with little ones, we'll get them sniffing, like, sound like that. And we'll get the spray and go and tell them to sniff it up. And so it helps, right? And we can do that. And then you can fog the house, right? You can get the EC3 fogger and the mold solution and fog the house on a regular basis, vacuum afterwards with the HEPA vacuum, right? Doing that, keeping it cleaned out, super, super helpful. Do your laundry and the laundry additive or the EC3 mold solution help limit mycotoxins and mold spores. We want to just limit your exposure as best we can. And EC3 has really great options to do that. And don't forget, guys, as we're talking about this, there are great current site-wide sales right now for Microbalance Health products. Some of these things, they carry the supplements, the candles. They have some of these as options, so check them out, okay? So we're seeing that. And again, don't forget that this is not medical advice, for your informational purposes only. So we're moving along really nicely, y'all. That's mold as an allergen stepping in. That was a couple ways. So yeah, Citri Drops is great. What product for headaches? So with the headaches, is it toxic? Is it allergy? Is it histamine? That's what we got to work with. But a lot of times, if one of my patients is having a mold-based headache, I'll say, take an extra dose of your binder, like bioactive binder, and go ahead and take some histamine support, like histamine relief. That'll help a ton. And in particular, we also use feverfew for headaches and histamine-induced headaches. Okay. If I can't take netinol, quercetin, or other herbs, could I take ketotifen? Let me say this. Ketotifen is a prescription mast cell stabilizer. So I don't know. I can't give you direct medical advice about that, right? You have to talk to your prescribing physician. What I will say is some of my more intense mast cell patients, they do work with their prescribing physicians to utilize ketotifen, and it's usually well tolerated. Any tips for pancreatitis from mold? Yes. Here's what causes pancreatitis. The pancreas gets inflamed often because the gallbladder or the bile duct or the liver gets congested or backed up. So we're going to go back to those drainage steps. Number one, get pooping. Number two, start opening up the gallbladder support. We find high-dose NAC, high-dose taurine, really, really helpful. Something like taking that mycotox detox support for the liver, very helpful. The milk thistle, phosphatidylcholine, magnesium malate, ginger artichoke. I see this all the time. Again, we're not treating pancreatitis with that. We're supporting the body and getting rid of the causes of pancreatitis. I see this consistently, very helpful. Clay baths. You can do clay baths to help support detox. Epsom salt baths with the magnesium sulfate, also very, very helpful for that, just to help pull toxins from the body. That's great. Clay baths, I find, are also really good with skin issues associated with mold, helps draw that out. So that's very good. Make sure you shower off afterwards. Yeah, somebody here said they taught their niece to do a nasal rinse when she was 2. If you guys got to believe in kids, a lot of times we're projecting our own junk onto kiddos, right? I have all sorts of pediatric patients. If you work with them, don't make it a big deal, right? They will learn to do a lot of this stuff. Do nasal sprays, take capsules, right? We got to do stuff to help their health too. Heather says she loves the candles. Every other candle bothers my asthma. These don't. These are all natural, non-toxic candles, safe for children, safe for people, safe for pets, guys. Like I said, we take them with us traveling for hotels. We can't control the environment as much. Super, super helpful. Thoughts on taking bioactive binder before or after sauna? I like people to take it beforehand, so it's sitting and floating in their system as they start to detox, and make sure you're hydrated. Make sure you're taking your electrolytes. Great time to take it. Can we access the recording? Yep, definitely can on there. Okay, what's the best way to optimize my liver health? Number 1, if you're in mold exposure and you can get out, get out. Okay. Number 2, take liver support like we talked about. Keep the bowels moving, keep them flowing. Limit processed foods, limit alcohol, things that stress the liver, right? That's a biggie. Get sweating, get moving. All those things are good. Liver support like milk thistle, artichoke, the myco detox liver support, taking binders on a regular basis, NAC, all that very, very helpful. Phosphatidylcholine, very helpful. Okay. So we're going to move into mold as an infection, and I'm just going to keep rolling here, guys. So if you got to go, check out the recording later, but step in and keep going. I'm just going to go try to answer all the questions and get through our material. And guys, if you're somebody who wants help guidance on this, feel free to reach out to our team here at Keystone Total Health, right? We work with tons. We specialize in helping complex chronic illness with mold illness. So if you need help guidance on some of this, let us know, okay? So mold as an infection, colonization, overgrowth. We can get aspergillus or other molds colonizing in our sinuses. We can get them colonizing our throat, our lungs, our gut, our skin. Then we got to deal with that, number 1, because now it's coming on as an infection. Number 2, those are still producing mycotoxins. Had another case today. They're out of mold, doing better since they got out of mold. She has a little fungal ball left in her sinuses. That was still giving her neurological symptoms because she's breathing it in all day long, right? So we started working with that to aid in it. So that's a big we got to work with. Somebody has a question on there. Maybe you guys can post this one up. Asked, when do we start with antifungals or start dealing with antimicrobials, right? So when do we do that? And this is a good step. For me, this is usually like step 4 in our process, and we individualize it, but it's usually step 4. So we talked about what to do if you're in mold, right? Somebody said they're in level 10 home. What do? We talked about the EC3 products like the foggers, the candles, that sort of thing. Get out if you can, right? That's step 1 for us. And you can use the mold test plates to figure that out as well from EC3. We even swab people's noses to sort that out. Number 2, we got to gently open up detox and drainage. We talked about this. Support the liver, kidneys, gallbladder, gut, get pooping, take a binder. That's step 2. And then step 3 is we've got to help with lowering inflammation. That's like dealing with allergens, histamine, that sort of stuff. Bring that down. Step 4 is we can support the immune system. Usually we can't do that until we've done those other 3 steps. So this is where this next one, mold as an overgrowth, dealing with the immune side of it, comes in handy, right? So what do? Start local. I have not seen a patient with long-term mold exposure who didn't have some form of sinus or fungal overgrowth or even bacterial overgrowth in their sinuses, right? Maybe it's candida, maybe it's aspergillus, chaetomium, something, but it's in there, right? So we can do great things like the Citradrops nasal spray. We also do some nasal flushing with the Nasopure. We put saline in there. Sometimes we'll put essential oils, silver hydrosol. We'll do the Citradrops. Those can go in the nasal flush. Those can go into a glass of water for gut, right? Um, Great for washing your fruits and vegetables in there. Very helpful on that. Those are all natural citrus seed extracts. Very, very helpful. The next one is for helping with our immune system is Sinus Defense 2.0. This is just an oral spray, right? Goes in there. It's got what they're called homeopathic nosodes. We have some videos up on Microbalance site of me talking about nosodes and homeopathy. I have some articles on the website. Check those out at Sinus Wellness, talking about homeopathy, how it works, why it works. So it's very helpful for helping the immune system learn to deal with the different molds. But even they have some things for like Lyme disease in there to help the body support with that, and the Sinus Defense 2.0. So we love that one. Very, very good, right? So dealing with that. Somebody says in here, I'm living in mold, 4 to 5 colonies on the plate testing, right? So what they're saying, let me see. Oh, you guys will love this. I got EC3 plate here. Okay. Oh, I'm just going to take a peek at the tree, make sure I'm going to, yeah. This is somebody's EC3 microbalance plate, right? Overgrowth. There's like, I don't know, probably 15 spores on here if you actually count them up, right? So this is what they're talking about. You can use these to test the air, tap, test, close. This off-label use, test the nose, right? And so you can use that to determine what's the mold exposure like. It's not a fail-safe, right? It's not for sure, but it tells you what's going on and gives you an idea. So this person says, I'm living in mold, 4 to 5 colonies on a plate testing. For me and my patient load, that's too much. I tell them 0 to 2. Okay. And Dr. Dennis, I think, recommends up to less than 3. And we go get a little farther, 0 to 2. And so, but using EC3 products to clean, and I can tell the air quality is better, right? We were talking about that. You can use EC3 products to clean your surfaces, clean the air with the fogger, clean your clothes, right? Helps. Thoughts on supplements to take. Again, start with detox and drainage. Get the bowels moving, support the liver, gallbladder, lymph, kidneys, bowels, and start using some binders if tolerated. Just stay hydrated on the binders, okay? And then third, we're going to jump into this, the fungal growth. We talked about the sinuses, right? And again, we're helping the body. This is just supporting the body in this and in doing this. And the next place we look at, so we just talked about the sinuses, and even that can help the throat. That can help clear out the lungs a bit too when you get into that sinus and get those big whiffs. And when I tell patients, like, get a big, deep breath, snort in there, close your mouth. So you get it in the sinuses, you get it in the nasum, you get it down the back of the throat, you get into the lungs, right? And so that can all help. And then even if you have, so like for instance, hopefully nobody's got a sound thing, right? So we can take citru drops, put it in our water, right? I'm not super sensitive, so I can put a few in there. But for some of you sensitive folks, you might need to make sure you measure how many you put in there. Okay, mix that up. And you can, even if you got like candida overgrowth in the throat or the tonsils are inflamed, right? You can gargle and swallow it down, help the body clear that out. Now, for the digestive side of overgrowth, stomach, small intestine, colon, we got candida, maybe aspergillus, whatever growing in there. To help the body get it cleared out, we want to go back, support histamine, because that's going to be probably a big driver at that point of driving it. So we can use things like histamine relief, low histamine diet, low antifungal diet at this point. We want to put people on that. So watch out for the carb, sugar, right? We have some of our, for the new year, some of our staff are doing the antifungal, anti-candida diet. We can do Digest Assist to support digestion, break this stuff down. The other thing Digest Assist does for fungal overgrowth is break down biofilms, as well as NAC breaks down biofilms. Those are like protective kind of houses that candida, bacteria, mold make to protect themselves. We can break those down to clear them out, help the body clear that out. We can use citru drops. Those are antifungal. They support the body in clearing fungus, yeast, those sort of things, right? We can use microflora balance and other probiotics to crowd out the yeast, right? We don't want a spot to do it. And they have their own defense mechanisms. They'll fight back. It'll be like a little boxing battle in your gut. Clear it out. And then you can use, I wish I had a bottle of this in. I just reordered some because I just sold my last bottle of this today, is Chitosan Bioflave. This is a new one from Microbalance. We love it. So microchitosan helps to break down candida, helps to break down fungal overgrowth, helps to break down biofilms. We use it. So that client today, I was talking about the fungal ball. We put the nasal flush. We put a low dose of the microchitosan bioflave, and of course, consult your medical provider first to flush it out because it helps to break down that fungal ball and clear it out. And with the bioflavonoids added, I talked about this earlier. This is rutin and luteolin. They're very antihistamine, anti-inflammatory, so they help calm that down. You do have to watch out if you're allergic to shellfish. Microtritoshin is derived from shellfish, so you have to watch out for that. Okay, and you can take it orally as a capsule, calm down histamine, help the body break down and clear out candida, fungus, that sort of thing. This stuff is game changer. Also binds up mycotoxins, right? And you can consider other natural antifungals like a blend like Candida Rid on the microbalance page. That's a good blend of like antifungals, antimicrobials, oregano, caprylic acid from coconut oil. You can eat coconut oil. You can cook in it olive leaf, thyme, copper as a mineral, iodine as a mineral, both antifungals, right? And the big one with some of these rosemary, thyme extract, like I said, majoram, those are all great ones too. Start cooking with more of these. If you're dealing with mold illness, you're dealing with fungal overgrowth, you can cook with more oregano oil, more MCT oil, more thyme, more olive leaf, more olive oil, majoram, rosemary. You can put more of this in your food. It will help you, right? It will help clear some of this out in your gut. So those are that's a biggies there for mold overgrowth. Let's answer some more of the questions here. I've been on Well-Call for 4 months and I still feel terrible. Well-Call is a prescription cholesterol medication. The way it actually works is it doesn't work like a statin. It works by binding a bile, which we said is how we get the toxins out of the liver. So it's actually a great mycotoxin binder, but it's really harsh on the system. It can be constipating. It can be hard for a lot of people. So, but it is a decent binder. My mycotoxins in my urine test are going down. So it's working. It's helping her clear out the mycotoxins. But this is frustrating. Should I be doing more than binding it? So I see this all the time. Sometimes this is because we didn't hit the other steps, right? Did we start with opening up detox and drainage? Are the bowels moving well? Are you hydrated? Are you supporting the liver, gallbladder, kidneys, lymph, gut, right? We got to go back and do some of that, right? That's step 2. Let's go back even further. Step 1, are you dealing with the home, right? I got to be at a convention recently where EC3 was there presenting a little bit. And this was for doctors and practitioners and things. And one of the things I told them was like, look, a lot of you know how to support the body in dealing with mold, but you don't know how to support the environment, which is where the mold is coming from. That's step 1. And that's why I love EC3. You can test with the mold plates. You can help the environment with the candles and foggers, etc. Are you dealing with your environment? Yes, you've been on Well-Call, but is your environment clear? And you might have to test work or other places you go. Step 1. Step 2, are you dealing with the inflammation? Are you helping to lower histamine? And then are you dealing with maybe fungus as an overgrowth, right? Are you dealing with candida? So we got to look at that as well and deal with that. And then maybe we have to look at some other factors. Like once those are up and running, we got to deal with the hormone system, other infections that mold because it suppresses the immune system allowed to go. Are you dealing with pituitary function? Dr. Donald Dennis, who started Microbalance Health Products, has some great research articles on the way mold suppresses pituitary function and growth hormone, which suppresses all these other factors, causes chronic fatigue syndrome, causes hormone imbalances, right? So should I be doing more than binding it? For sure. Detox and drainage is the next pathway, and check out your home, right? Again, not medical advice, but that's what I would do. When am I ready for antifungals? Kind of talked about this one. Is any suggestions on a multivitamin for somebody that's already deficient but sensitive to a lot of vitamins, or which one to start with? First of all, I don't start right away with that, but you can work with some. I want to start with those other steps first. Are you detox and draining? Are you working with a binder? Are you dealing with inflammation and histamine? Are you clearing the overgrowth? Are you supporting digestion so you can get the nutrients in that you're already eating from food, which is where we should get most of them, right? So are you doing a digestive enzyme? If you can tolerate, are you doing a probiotic or immunoglobulins, right? We need to do that. And if not, start there. Next, I would say there's a couple of good liquid options for some multivitamins on the Microbalance Health page that we'll use with some patients. And I like that because you could start with a drop and just add a drop in to go. And so that's a good all-around one, well tolerated typically, good sourcing on those. So that's a good place I would start. But for a lot of folks, I look first at minerals and then at vitamins. So I'll add in minerals first to see what they're deficient or what they need, and then look at that, but not before I start with digestion, right? So we got to start there and try to get the diet up and running. Thoughts on antibody mycotoxin serum test as opposed to the urine test? Yeah, I have a lot of thoughts on it. It's a good test. It's helpful, but we have to ask ourselves, is it measuring actual mycotoxin load or your immune system's response to mycotoxins, right? And it's what it's measuring is your immune system's allergic response to mycotoxins. So you might not be being exposed and your mycotoxin count might be way lower, but you're still responding heavily to any of them, right? And so the typical treatment prescribed for that one is a pharmaceutical antifungal, which does work well, but it misses the point, right? So regardless if you're doing the serum test or the urine test, and we do primarily use the urine test personally and prefer that. That tells me how many mycotoxins are actually being cleared out of the kidneys and system, and it gives me a good tracking versus the immune response to mycotoxins. We're asking two different questions. We're asking mycotoxins as an allergy and overgrowth, not so much as a direct toxin unit. So it's helpful. I don't use it much. I prefer to see the urine mycotoxin, like real-time labs, or we use some other labs as well in our clinic. Those are good sourcings. We do that, find that works very well. And it's a better tracking for us. It's still like the antibody testing is still good. It's just measuring something different, and you need to still deal with them as a toxin and deal with them as an allergen, not just an overgrowth, which is kind of where that started, which is focusing just on overgrowth. Let's throw up some more. The citrate drops need to be cycled on and off. In general, I cycle my clients and patients on and off everything. We typically do 5 days on, 2 days off of everything if tolerated. Sometimes patients need 6 days on, 1 day off to start, but we do cycle on and off. And so with citrate drops, probably people do like a month or 6 weeks, take a break, go back on, that sort of thing. So we do have them do that. But again, we start those a little later in the process. A lot of times when we're dealing with the overgrowth, we're starting the other products earlier on that. Guys, why do these work? Why do these supplements actually work? Number one, they're high quality, they're tested, but we're using them in a strategic, systematic fashion. There's a reason for everything. It's not just, is this good for mold? It's what's its purpose in the body, and does it work synergistically for you and everything else you're doing? That's why we might not just say citrate drops are great for mold. Should we start there? Not necessarily. We might have to start with detox or drainage. We might have to start with cleaning your environment, with fogging solution, with mold candles. We might have to start with histamine support for you, helping the body lower inflammation, right? We want to do it in a systematic, orderly fashion. What other questions do we have, team? Do we have any other questions coming up here? Doesn't lumbrokinase break down biofilm? Also, lumbrokinase does. It's a different type of proteolytic enzyme made from silkworms that breaks down biofilms and lowers inflammation. That's a great one. There's serrapeptidase does as well. Proteases, they all also break down biofilms. Some of the different essential oils, rosemary, thyme, break down biofilms. Like I said, NAC, digestive enzymes, break down biofilms. So lots of factors, but you're absolutely right. They do. I'm headed to England at the end of the month for fecal. So FMT stands for fecal transplant. If I have mold in my gut, will this prohibit the transfer? It won't necessarily prohibit the transfer, but it will decrease some of its functionality. Often, if I have clients who are going to go do FMT, I will have them do some cleanses ahead of time. Well, number one, I want to make sure their mycotoxin counts are down. They're out of that detox period. They're not living in mold. Number two, I want to make sure we've detoxed them well. Number three, if they have candida or fungal overgrowth, we want to try to deal with that to at least a decent degree beforehand. So keep that in mind, guys, if you're going to do FMT. Do I need specific kidney support? I am peeing constantly and worry this is hard on them. So frequent urination is a direct symptom of mold and mycotoxin illness because it decreases one of the hormones that helps us retain our fluid, and it's hard on the mycotoxins are hard on the kidneys. So number one, just keep trying to stay hydrated. Number two, increase your electrolyte intake. Sodium and potassium intake, increasing that. Add salt, add electrolytes to all your water helps a ton on that, right? On that, taking binders, I find helps a ton on that. And then direct kidney support can be helpful there. Ginger, milk thistle, like that's in the myco detox liver support. Those are also kidney supportive. Silk tree can be helpful, right? Those are also, and sometimes you want to use like astringent type herbs in there as well, but that gets a little more deep into some herbalism and Chinese medicine that we can talk about. Astringents are like witch hazel and and some of the like red root and things like that. But those can also be helpful to help you retain. But number one would be electrolytes in that. And so that would be really helpful at that point with the kidney support for frequent urination. The other thing is like later on when I was talking about we got to do hormone support because the frequent urination is stemming from the pituitary gland, which regulates our hormones. Cell-tropin is very good with that. Dr. Dennis designed that based on some of his research with the growth hormone and pituitary suppression from mold toxins. So we use cell-tropin to support that pathway as well once you've done some of the detox and you're out of the mold. Personally, with my patients, if they're having frequent urination, I also limit stevia with them. That seems to help as well. What other last minute questions do we have rolling on here as we're kind of getting close to the end here, getting close on time? And guys, check out Microbalance Health Products page for any of these products we talked. Check out Sinus Wellness for more information. If you're looking for practitioners who are trained and deal with mold day in, day out, every day, working with clients and patients on it, check out Keystone Total Health on our webpage, on our social media. We'd be happy to work with you and help. I can hardly eat anything but supposed to take supplements with food. Any tips? Start low, microdose. Open the capsules, start with pinches. Start with histamine support. If you're struggling with food intake, back up. Start with histamine support, right? Reduce high histamine foods, reduce your trigger foods, right? And then start with opening up the histamine relief capsule, taking a little bit with water. You can take that on an empty stomach. You don't have to take the capsule, and you'll find you'll start to be able to build up. And again, not medical advice, but we see this all the time. It helps a lot. Start with a pinch and work your way up to a full capsule. Okay. And if you've got stomach issues, digestive issues, a lot of patients do well to open up the capsules and not take the capsules. Can mold cause potassium deficiency, or it could be from Lyme? I don't see that. So with chronic Lyme disease, most of those folks I see have mold illness because it's suppressing the immune system, allowing mold to stay present or Lyme to stay present. But often what I see is that the mold illness will tax the adrenals, allowing potassium to be excreted heavily. It will cause overdrive in the nervous system, allowing us to pee out tons of potassium. It'll cause frequent urination, so we pee out our electrolytes, right? You can start to see the pattern there where it's causing potassium depletion. We see it all the time in hair mineral tests. We see in blood tests where it's limited that. So you can take electrolyte supplements. You can take potassium chloride, cream of tartar is a good one, a good source of potassium. Fruits, veggies are good sources of potassiums, sweet potatoes, kiwis, fruits, those sort of things, all great sources of potassium. Laura here again, is allergy a big component to fatigue if I don't really get much of allergic symptoms? It can, again, if we see that factor, and sometimes we have to see this on tests before patients really see it in symptoms. I might see it in high eosinophils on a blood test, high histamine in urine, that sort of thing, high eosinophilic or histamine results in a stool test tell me we need to support the body in dealing with this. But a lot of times your allergic symptoms might be gut symptoms, might be nausea, gut pain, bloating, might be low blood pressure, might be adrenal fatigue, fatigue after meals. That might be your first allergy symptom, right? A little bit extra mucus, thick mucus might be an allergy symptom. So that can be a factor. But if that's not helping, if taking histamine support is not helping, we probably need to look for fatigue more in the toxin pathway, in the hormone pathway, like adrenals, and then your mitochondria as a factor. A big twofold for supporting detox, the liver, the brain, and mitochondria is phosphatidylcholine. I find that helps. And for some folks, it gives them a big energy bump. For other folks, it relaxes them. For me, it relaxes me. So I find if I take it with dinner, it relaxes me. But then in the long run, if I'm consistent on it, my overall energy level is higher. So that's a great one to do because it supports mitochondria function and brain function as well. And if you're fatigued with adrenal health, taking a little extra salt goes a long way. Salt your water, right? Goes a long, long way in there in supporting that function. Okay. Do we have any last seconds here? Joint pain tips. Number one, deal with inflammation that's in there, right? A lot of my patients, when they're exposed to mold, get joint achiness. Work with the histamine support. That's very, very helpful. The liver supports help clear it out, but also because a lot of those are anti-inflammatory in there. So that's a biggie. Phosphatidylcholine helps lubricate the joints in there. So those are biggies, but I would start with something like histamine relief. Really helps to lower histamine overall. Very helpful on that front. But we got to lower the inflammation. That's the key. NAC is also great for lowering inflammation. Turmeric, turmero, fish oils, all very good for lowering inflammation. That's a biggie. Okay. Let's take any last minute questions, team, on there that I didn't get to as we're wrapping up here. I think we might have covered it all. You guys, this was great. Don't forget to check out Microbalance Health Products page on YouTube, Instagram, Facebook for the recording when we're done. Check out their page for their products we talked about tonight, but just in general, now you know how to build a supplement program to use supplements that actually work for mold and for Sinus Wellness. If you want to really get some great information, they have tons of articles on there, videos. They give you step-by-step guides. That's a great place. And again, today's associated articles on there. I had so much fun, you guys. Throw us a like and a follow on these pages if you're interested in more information with this. We do these quite often with Microbalance. I really enjoyed it. Y'all take care and good night.